So the big question that everyone always asks is, why do you want to be a CRNA? The anesthesia profession has always been very appealing to me from the very first time that I saw a CRNA in action. I was very intrigued by the OR environment and the level of intelligence, critical thinking skills, and the complexity that the anesthesia field entailed. Pursuing this career was the sole reason why I decided to go to nursing school, so I'm looking forward to continuing my education in this profession. Due to my experience as an ICU nurse over the past few years, I know that anesthesia is the natural progression from ICU nursing. I've come to realize that my favorite patients are intubated, sedated, and paralyzed, which is obviously exactly the type of patients that CRNAs take care of. I like being in control of my patients and working in a high acuity environment that requires rapid assessment and intervention to ensure the patient's safety and improve their overall outcome. I enjoy monitoring their vital signs, initiating and titrating drips, to keep those vitals within a certain range, as well as assessing their respiratory status and providing the appropriate level of support in that aspect, as well as administering medications to maintain an adequate level of sedation and pain management to keep my patient comfortable, which is obviously exactly what a CRNA does. CRNAs basically take control of every body function during a surgical procedure, from a patient's ability to move, to breathe on their own, and even to remember what happened during the surgical procedure. They administer medications to keep a patient sedated and to keep them pain-free and hemodynamically stable. So I feel like a CRNA's role is exactly what I really enjoy. I also like how CRNAs focus on one patient at a time, so this ensures that I can give my undivided attention to my patient, constantly monitor their status, and adapt my plan of care appropriately to ensure that they have a safe and successful recovery from an anesthetic standpoint. One unique experience that I got to participate in the pediatric cardiac ICU was a bedside sternal chest closure. Instead of taking the patient back to the OR, the surgical team and the surgeon comes to the bedside. And as the bedside nurse, I was responsible for maintaining adequate sedation and pain management during the procedure. I would monitor my patient's vital signs and their level of consciousness, and respond by administering appropriate medications under the supervision of an attending physician. So being able to act as the anesthesia provider, as you say in this case, it just highly piqued my interest even more in this field, and further strengthens and confirms my desire to become a CRNA. Also within the realm of anesthesia, there are still so many different routes you can take, whether that be working in a hospital, in an outpatient surgical center, in a doctor's or dentist office. So even though anesthesia is a high specialty in nursing, I still believe that there are so many different career opportunities available in this field. You can work under the supervision of an anesthesiologist, in these larger medical centers, or you can also practice more independently, in these rural areas, such as the local hospital where I am currently from. I realize that there's a significant job opportunity in the future as an anesthesia provider in my community, so I really want to pursue this career to be able to address this need in my community and fulfill this position by providing more healthcare opportunities to my hometown community. As I have gained more experience in a critical care environment and have been able to shadow CRNAs, I am very confident that the roles and responsibilities of this type of nurse align perfectly with my personality and my capabilities as a medical professional. I know that I'll be able to handle the critical situations that CRNAs face with ease. I'm very passionate about this profession, and I know that becoming a CRNA is exactly what I was meant to do.